Last week, the Gallup poll for 2011 was released. The most trusted professions in the United States, nursing is #1. #2 is pharmacy. We beat out the #3, doctors, by 5 points. When I got out of school 30-some years ago, I was on fire to save the world. And I so badly wanted to be respected for all the hard work that I put into pharmacy school. And my very first job was in a pharmacy. Back then, women were not pharmacists like they are now. And the other two pharmacists, so let's just say Marcus Welby was everybody's idea of a doctor. And the two pharmacists that I worked with looked a lot like Marcus. They looked wise, experienced. And then there was me. I worked on Wednesdays and Sundays, and people would come up to the pharmacy and they'd look and they'd say, "Where's the pharmacist?" "I'm the pharmacist." Yeah, because frankly, I looked like I was barely old enough to drive. And they were used to seeing fresh young faces back there as clerks for the pharmacists. This went on for about 6 months when I finally gave in and joined the hospital pharmacy staff, where you're invisible. Nobody worries about how old you look. They just want to know, can you do the job? And I thought that that was really a very good place for me. When I met my current husband, we've been married almost 30 years, he was shocked. You work in a hospital? I didn't know pharmacists worked in hospitals. I thought they just worked in drugstores. Little did I know that it would work the other way, because my mother-in-law never did figure out that I was a pharmacist. She just couldn't get her brain around it. I worked in a hospital. I was a nurse. I was a nurse. And I thought, oh, well, what can I say about that? Okay, until I heard her bragging about her daughter, the pharmacist, and I thought it was me. She finally figured it out. No, it was my sister-in-law. Well, that was fast. So I listened and listened. I said, well, gee, how did she become a pharmacist? Well, didn't you hear? Didn't she tell you? She got a job at the pharmacy at Walmart. She's a pharmacist, because all pharmacists work in drugstores. You can't always get respect. You just can't always get respect. So, medications. We have a fragmented medical care system. It is so fragmented. It looks, this time of year, the older people are having to pick their Medicare drug benefit plan. Who work still, we have maybe one plan, two to pick from. Our grandmothers and mothers have to pick from an enormous amount of choices. It's like if your grandmother's never been in the Starbucks before, and she walks in, "Can I have a cup of coffee? Is that Americano or a latte? Do you want milk with it? Okay, I'll have milk with it. Oh, you want a latte. What kind of milk would you like with it? We have soy, we have almond, we have cow's milk." Grandma goes, "Cow's milk? Okay. Would you like that 2% skinny or whole?" And Grandma's going, "Oh my gosh, I'll take the 2%. That's great. Now, would you like one shot or two?" "One shot." Grandma's going, "One shot. I'm just talking coffee." Whatever. And finally, is that going to be a tall, a grande, or a venti? At which point Grandma goes, "You're not even speaking English," and turns around and walks out. Our medical care system, our healthcare system is fragmenting and has many more choices than it used to as well. Instead of one doctor, you have a doctor, a family doctor, a dermatologist, OBGYN, obstetrician or a gynecologist. I have a rheumatologist, and some of you might even have cardiologists or urologists if you are old enough. But all of these different doctors have one little piece of your medical care, just one little piece. And then there's where you can go for medical care. There's clinics, doc in the boxes, ERs, All of those are more slices of this pie. Okay? Instead of one person being able to keep track of it all, you've got all these little slivers left in different places. And hospitals, the same thing. It used to be that your doctor would see you in the hospital if you got sick. Not anymore. Regional upstairs, they have hospitalists, employees of the hospital. So your doctor stays at the clinic all day and the hospitalist makes rounds on you. And if you thought that was crazy, last week Memorial announced that they have doctors who take care of you when you're in labor, not your OB/GYN either, your OB or your family doctor. You know what they call them? Laborists. Fragmented. Is that a good thing? Not always. But we think, well, computers will save us from this fragmentation. They'll save us. You know, the Terminator 2 Skynet, all the computers got together. Well, I think there's a conspiracy out there in medicine called MedNet. And I suspect that computers are really running the show behind the scenes. How many of you have gone to the doctor lately and they've given you, stuck a clipboard in your face with a pen saying, fill this out? Well, I just filled that out last time I was here. Nothing's changed. I'm sorry, we updated our computer system. We're updating our records. How many of you have been to the doctor where in the doctor's office the doctor has a laptop in there with you? Now, here's the crazy thing. They make you turn your cell phone off. But the doctor is staring into this box, muttering to him or herself. They didn't teach me how to do this in medical school. You're going, hello, hello, I'm here. If you try to make an appointment, you know that the computers are in charge because they say, I'm sorry, I cannot make your appointment right now. My computer system's down. And this is how also I know that the computers are really running the show, because anything that happens, guess who gets blamed? It's the computer. You call in and say, my reminder call that reminded me of my appointment, it was in Spanish and I don't speak it. Oh, that's the computer's fault. Or my prescription's not at the pharmacy yet. Well, it shows that it was faxed. The computer faxed it. Whenever we get to the point where computers are blaming computers, we'll know that they are truly omnipotent. But right now, we have computers that don't really talk to each other. We have lots of little pieces, and that can be a problem. It can be a problem, fragmenting of healthcare. The other thing about healthcare is that the media calls it healthcare, but really it's probably medical care that we're talking about, because 75% of all clinic visits or ER visits with physicians or providers end with a prescription. Did you know that? 75%. 50% of all the Americans in this country have taken a prescription medicine within the last 30 days. 90% of older folks have taken a prescription in the last 30 days. 90%, 9 out of 10 older people are taking a prescription medicine. 37% of those older Americans are on 5 or more prescriptions. Do you know what I call that? Job security. But what it also is a potential for harm. These medications that are so powerful are unpredictable. It's not unusual for someone to be able to take ibuprofen for pain, but naproxen doesn't do anything for them, but they're basically almost identical medicines. The downside of medication is most evident in the elderly population. 67% of elderly Americans that are taking more than 5 drugs or more are going to have an adverse drug event in any one year. So over the next year, they're likely, 2/3 of them are likely to have an adverse drug event. Okay? 10% of those folks are going to end up in the hospital. There's 175,000 visits in the ER every year from drugs gone bad, adverse drug events. How can we prevent this? How can we prevent this? And it's worse than you think, because if you added up the number of prescriptions that people are on, and you look at what contributes to death in this country, adverse drug events would be number 4 on the list. 4th leading cause of death in the United States, complications from medications. Now, the CDC says the first on the list, as far as the death certificates, is heart disease. Number 2, cancer. And number 3, stroke. And then lung disease. But if the CDC had a spot where you could put adverse events from drugs contributed to this person's death, it'd be right up there. So this is something that we want to be able to prevent. I promised you today that I would give you a key to getting better care from your doctor immediately, and a key that would prevent you, significantly reduce your risk of having an adverse drug event, not for just you, but for your family members and loved ones. My sister-in-law, the pharmacist, was chosen to take care of my father-in-law because she knew medicines so well. Right. I helped take care of him, and she was so confident in my information that she locked everything up and only gave us the pill box. We didn't have the list of medicines. The bottles and the list were locked up, and so we were only supposed to give him the pills in the pill box. Okay. Now, I have a secret weapon that I'll share with you. Do you know how to find out what a pill is? How to identify a pill? If you do this, you will never have to worry about taking it to the pharmacy and asking them, can you identify this for me? I will give you the pharmacist's deep, dark secret. We Google it. We get out a magnifying glass and we look at the imprint on that pill. And we put in the color, the shape, and the imprint pops right up every time. And we look so knowledgeable. Which is what I did with my father-in-law's medications. So I had my own little way of checking it. She decided that he was getting wobbly, and she called the doctor and was referred to the neurologist. He'd been to the neurologist about a year previous when he had his stroke. So she felt that he needed to go to the neurologist. So she bundled him in the car, went to the specialist office, checked him in, and then came the question. What medications is he currently taking? I don't know. Do you have a list? Why, yes, I do. And do you have it with you? No, I don't. It's locked up. It's safely locked up. Unfortunately, they couldn't do a thing for him because they didn't know what medications he was already on, and he was on at least 5. So that was a total waste of time, copay, and the doctors were frustrated. You, however, can get great service. You can be the equivalent of Frank Sinatra giving out $100 tips. Bring a current list of all of your prescriptions to every doctor's visit, every hospital, ER visit, every doc in the box, every dental visit. Keep it updated and put your prescriptions, your over-the-counter products, the non-prescriptions, and any of the herbal products that you take, vitamins and supplements. You will be a superstar in the eyes of your providers, because now, instead of spending their precious time with them trying to extract this information, they can get down to the actual business of talking to you and finding out what's wrong. And they're so much less likely to give you something that will cause you a problem, whether you are allergic to it or whether you're going to interact with something you're already on. So again, our medical system is fragmented. Our medical system has lots of little pieces, and your doctor has no way of collecting all of those pieces together easily in the very short time they have with you in a clinic visit or in a hospital. Do yourself and them a favor. Always have a list, a current list of your prescriptions. Bring it to every doctor's office. They will appreciate you. Thank you.